Well, the intersection between health literacy and health equity is more of a prerequisite than it is actually an intersection. I believe that we need health literacy in order to obtain health equity. Health literacy is actually defined as the degree to which individuals can process, understand basic health care information. And so considering we have about 30 million people that don't have basic health literacy, we can see that those numbers are so large that we're really going to need to be able to have literacy before we can have equity. I'd also like to point out that I think it's really important that we ask some hard questions about how we teach and how we provide the information on health literacy. We have the majority of teachers, or those providing information, typically are not ones that fit into that 30 million. So therefore, we have to learn how to teach and provide information to people in an honoring way, a respectable way, and to really meet the student where they're at, and once again, not attach somebody's lack of health literacy with the value that they have as a person. I think that's so important. Well, I think it's pretty clear if we take a look at the latest statistics and information that we have that really where you live and where you grow up, it does determine your level of education. Unfortunately, we have people who live in particular zip codes who not necessarily get the same education as somebody who lives in a different zip code. So when we're talking about education, it is a key role, if not the most important role. We need to be able to get relevant, honoring information in the hands of people so that they are able to navigate the healthcare system. We absolutely know that there is a direct link between how much education you have and the amount of money that you will make. Those numbers are out there. If you have an associate's degree, a bachelor's degree, a master's degree, studies have actually done the math to see how much money you'll make in the future. Add on to that racial dynamics, socioeconomic status, and then we throw in some different information, even have probably a greater disparity in some of those numbers. And so when we're talking about having a healthy lifestyle ultimately, when you're thinking about having an associate's degree, a bachelor's degree, a master's degree, you're also going to kind of attach to that, do I have health care insurance? And then, is my health care insurance paid for, or do I have to pay for my health care insurance, or do I not even have it? And so all of those things kind of meet hand in hand as we go throughout life. What our community needs to do to achieve health equity is a big question to answer. I think that I would probably answer it with 3 different steps. I think that the first step that we need to do is really admit, agree, and validate the fact that things aren't fair, that we live in an unfair society, and that equity is really fairness. It's saying that we have a fair community, that we have a just community. Equity is actually defined as fairness and just, and so when we're thinking about health equity, we're thinking about a fair distribution of health services, care, access, all of those kinds of things, as well as just services. And if we take a look at some of the latest data, for example, Unnatural Causes is a project that is kind of launched in 2008 and continues to make waves in communities all over the place. But it basically talks about 70% of Americans believe that we do not have any type of racial inequities right now here in the United States. 70% of Americans believe this. So if 70% of Americans believe that we have absolutely no problems in regard to racial inequities, then we really don't have a common denominator of validating that we have an issue, validating that we have some disparities and some inequities going on in this community and beyond across the United States. So we really need to validate that fact that we do have inequity, we do have an unfair system, and those are based on whether somebody's racial dynamics are included in that, socioeconomic status is also included, and then disabilities. People that have disabilities are also included in that as well. So we have to first validate that as a society and as a community here in West Michigan. We don't know what we don't know. So once we validate, or at least validate the fact that we might have an issue and I'm open to know about that, we have to fully understand what that issue is. We have to understand what the root cause is and not just necessarily see what's the things that it's producing. We have to actually go down to the root of the issue and understand really what's happening here to get at how do we solve it. I often say when I'm doing strategic planning that if we don't know what the real problem is, and if we don't know what we want the solution to be, then we really are spinning our wheels when we're planning. So first we have to get at that. We don't know what we don't know. What's really going on here? And an interesting phrase that came out of the Unnatural Causes as well, I think, is that the choices we make are shaped by the choices that are provided to us, that we have throughout life. The choices that we make are really shaped by the choices that we have in front of us throughout life. And so if you didn't have a choice of the quality of health care, you didn't have a choice of your access, and you didn't have a choice to some what we might consider as basic life opportunities, then we really don't even know how to make appropriate choices when we go back to that education piece. I think the third thing is probably the most important thing out of everything else that I have to say. And that third thing that is so important in achieving health equity is to make sure that we are providing encouragement and hope for the people that have already decided, yeah, things aren't fair. We really need to do some work. And you know what? We're humble enough to say we don't even know all the issues. We don't even know all the root causes. We're just here to try to dig in and work as hard as we can. We need to be able to provide people that are doing that work on the front lines with the encouragement, the hope that they need to be able to continue to do this work. It can seem like an overwhelming thing. And without hope, we can just get weary and we can feel like we're not doing our part. And I think that we just have to be reminded. A mentor once said to me, that, and it just has stuck with me throughout all these years, that there are many more for you than against you. There are many more for you than against you. And I think we have to remember that in this health equity work, that there's many more in this community that are for health equity than are against it. When we're talking about whether we really are focusing on these core issues or understanding these core issues, I think it's important when we're talking about especially racial inequities that we mention this whole idea of denial. We have an American society where we have this idea that denial and guilt have been pushed down and that it's really just easier to believe the concept rather than what we believe is operational. All men are created equal. And so it's easier to believe that concept and that it's actually happening than to dig deeper and realize that maybe that this isn't really true. It's easier for us to kind of stay isolated in our communities. I often say we're taught to be separated from each other. We've been taught to be put into suburbs or put into urban communities or put into rural communities. And it doesn't happen very often where all of those communities intersect, speaking of an intersection earlier. And so therefore it's easy to deny somebody else's life experience if we don't necessarily have to witness that life experience or see that life experience weekly, daily, monthly, at all. And so we kind of have this idea of denial that we push down, and therefore, when it is approached to us, or when it does get presented to us that there perhaps is some racial inequities, it may surface some of these feelings of guilt and shame of, wow, has this really been happening all of these years? Is this still happening? And it's important to recognize that that's not necessarily the time to pounce on somebody with, hard data. It may just be opening up a conversation to ask some additional questions and create a dialogue where we can really understand, kind of unravel all what's happened over the last 750 years. We have inequalities in so many different groups. Some people like to call groups marginalized groups. I'm not really a huge fan of that word, but I think it's important to recognize that we just have many groups of people who don't have the same access to health care. They don't have the same quality of health care, and they don't have the same life opportunities. We can talk about it based on socioeconomic status. We can talk about people who have disabilities, perhaps falling into that category as well. And so it is important that we do a broad stroke of understanding who might not be receiving the same type of health care that what we may paint in this country as just something that happens implicitly or naturally, and maybe it's not. I think it's so important that we don't attach the idea, if somebody has a lack of health literacy, to the value of who they are as a person. I think that's probably the most important piece of all of this work.